Did you know that almost 50% of all pregnancies will terminate spontaneously? What are the reasons why pregnancies may fail to progress? Alright guys, welcome back to my channel. I'm Dr. Kelvin. I'm your wellness consultant, which means your health is my topmost priority. Happy that you're here. Don't forget to hit the subscribe button and let's build this community together. Alright, now as you're here, we're going to talk about a very important subject, especially for couples trying to conceive or trying to get pregnant, and that is miscarriages or abortions. Now, we prefer to use miscarriage because abortions have some kind of negative connotation, so we don't use it as much, so we say miscarriage. Now, miscarriages may be spontaneous or may be induced. Induced is where you go and get the pregnancy terminated because you are not ready or one other reason or another. But spontaneous miscarriage is what we are talking about today. Now, did you know that almost 50% of all pregnancies will terminate spontaneously? Now, that's a huge number. Most of these terminations will actually occur before the woman is even aware that she was pregnant, right? In women who know they are pregnant, up to 20% will terminate spontaneously. What are the reasons why pregnancies may fail to progress? The biggest reason why pregnancies fail is usually due to chromosomal abnormalities. In other words, the baby did not form right. Every baby receives half its chromosomes from the father and another half from the mother, put together becomes you. Sometimes the baby may receive too many chromosomes from one partner or very little chromosome for the other partner, and so the resulting baby is not viable, and that's the biggest reason why pregnancies terminate. So any situation or any condition that would result in these chromosomal abnormalities will result in a miscarriage. It's kind of like the body's own quality checking mechanism. So if the baby does not meet the standard, that baby is out the door. What are some of the conditions that would promote these chromosomal abnormalities? The single biggest reason why most pregnancies would fail is actually because of the age of the parents, not the woman. Now, in the past, a lot of focus and attention was put on the age of the woman, which is indeed a fact. I mean, it's well established, right? Women under 30 have only 1 out of 10 chances of having a miscarriage. In other words, if 10 women under 30 got pregnant, only 1 will probably have a miscarriage. When you look at women above the age of 45, up to 5 pregnancies will end in miscarriage, which means that the age definitely plays a role. But what we are finding out in recent times, in the past decade, research coming out is also talking about the age of the male partner. Yes, the man's age also plays a key role. In fact, the older your partner, your male partner is, the higher the probability of you as a woman suffering, in quotes, a miscarriage. And so the age matters in both the man and the woman. And so if you're a couple and you're trying to get pregnant, the age counts. So if you have an opportunity to get pregnant at a younger age, take it. If not, understand that you might experience certain challenges in conceiving, and so get involved or involve your fertility doctor earlier in the process so that we can help you, guide you, and help you achieve your goal. Very important. So age is a factor. The second biggest thing is obesity. Yes. Now, obesity, if you follow me, if you subscribe to my channel, you know how much we talk about obesity. It has a role to play in a lot of things, from cancer to hypertension to diabetes, among other things. And yes, obesity will also cause you to suffer significant losses when it comes to pregnancy. It affects your pregnancy all through the pregnancy journey. Obesity can cause problems. Obesity causes insulin insensitivity, and this insulin insensitivity can result in pregnancy-induced diabetes, which can then affect the fertilization, the implantation, the development of the baby, even to the point of delivery, where the baby might become too big such that you might require intervention in delivering that baby. And even after that baby is born, there's still a significant risk of dying of the baby that has been born. And so babies born to diabetic mothers have to spend longer in hospital so that we can make sure, keep an eye on them and prevent them from actually dying, within that period. Very important. And so if you want to reduce the risk of pregnancy-induced diabetes, then you want to make sure that you are maintaining an ideal weight as much as possible. Very important. Obesity can also cause pregnancy-induced hypertension, which could lead to preeclampsia and eclampsia, and could result in pregnancy loss at any point in that pregnancy. So it's very important that we try and maintain a healthy weight as much as possible. Number 3, alcohol, smoking, recreational drug use. All these things could result in pregnancy loss. Smoking in particular affects the blood vessels such that blood flow to the developing fetus is challenged, and this could result in pregnancy loss or termination during the course of the pregnancy. It also affects the development of the placenta, which usually starts later in the first trimester. So smoking is a big no-no. In fact, mothers who stop smoking as soon as they recognize that they are pregnant have 25% reduction in the risk of pregnancy loss. So this is very significant. Smoking, no. Alcohol's effect on babies have been well established, well documented. Fetal alcohol syndrome is well known, and so you don't want to drink alcohol when you're pregnant. And it's not even a function of how much the quantity of alcohol you're drinking. It could be 1 glass, it could be 20 glasses, it doesn't matter. Fetal alcohol syndrome does not depend on the amount of alcohol that you consume whilst pregnant. Very important. And finally, your overall well-being, your nutrition, all these could affect the likelihood of your baby surviving. And so you want to make sure that pre-pregnancy you have good nutritional stores. You are eating well, as you prepare to get pregnant. And then during pregnancy as well, in spite of all the challenges that pregnancy comes along with, the vomiting, the nausea, etc., you must try to maintain adequate nutrition so that the baby can survive on your stores. Very important. Now, infection is the final thing that causes pregnancy loss. There are a particular group of infections that are very notorious called the torches, including toxoplasma. These infections are notorious for causing pregnancy loss, or fetal symptoms or fetal effect of these infections could result in neurological delays, among other things. And so you want to protect yourself as much as possible. If you find yourself in the tropical areas, malaria is a big cause of pregnancy loss. And so as part of our antenatal schedules, all women are screened for malaria and treated presumptively or treated prophylactically against malaria because it can cause disastrous effects. And so make sure that you follow all the advice, and then you and your baby will be healthy and happy as much as possible. Once again, I'm Dr. Kelvin. If you have any question, feedback, leave it in the comment section. And make sure that you subscribe to this channel so that together we can build this wellness community. Thank you very much. Have a fabulous time. Stay blessed.